Testing the visual fields. In this video, we will demonstrate how to assess the visual field. There are very sophisticated machines called perimeters that can be used to do this, but they're not always available. It is possible to test the field very simply to confrontation, however. Make sure that you and the patient are sitting comfortably. The room should be reasonably well lit and free from distractions and other people moving about. You should be facing the patient. Your eyes should be on the same level. For all tests, it's important to test each eye separately and to ensure the untested eye is well covered, either with a patch or the patient's hand. The type of stimulus you use will depend on the patient's visual acuity. For those with poor vision, able only to detect light and dark, start with the ability to see a light. We are going to divide the visual field into quadrants with a vertical and horizontal line intersecting at the point of fixation. The point in the visual field where the dimmest, smallest lights can be seen, corresponding anatomically to the fovea. The field can be further divided into a nasal and temporal hemifield and a superior and inferior field. These confrontation tests will reveal large defects in the hemifields or superior and inferior fields. They will not show small defects. Tell the patient what you are going to do. Ask them to say when they can see the torchlight. They should look straight ahead. If they have very poor vision, they may have difficulty fixating, however. Hold the torch in the center of each quadrant of the visual field and illuminate the light for a few seconds. This will give you a measure of whether the patient can see in all quadrants of the field. Testing the visual field with hand appreciation. For patients with better vision, a variety of simple tests are available. Again, test each eye separately. Hold both your hands in front of the patient at a distance of 50 centimeters. There should be a slight gap between your hands through which the patient is able to see your nose. Ask them to stare at your nose and report whether the two hands appear identical. Patients unable to see one hand clearly may have a defect in that hemifield. Patients with loss of the superior or inferior hemifield will report the corresponding absence of parts of both hands. Testing the visual field to counting fingers. This provides a little more sensitive measure of visual field defects. The field is again divided into quadrants. One eye is covered and the patient asked to look at the examiner's nose. The examiner exposes between 1 and 4 fingers at a distance of 1 meter and in the middle of each quadrant, starting peripherally. It is important not to test along the vertical and horizontal axes. If the number of fingers is correctly identified, the examiner moves on to the next quadrant. If not, the fingers are moved towards fixation until the correct number are seen. Testing the visual field with a red object, for example, a red pin. This is a more refined means of testing the visual field than finger counting. Patient again covers one eye and fixates on the examiner's nose. The red object, held at arm's length from the patient, is slowly introduced into the visual field from the periphery. Do not move it too quickly. Again, it is important to bisect each quadrant. The patient is asked to say when the object is seen as red. This is important, for the patient will see a black image before they appreciate the red color. It is possible to use this test to compare the visual field of the patient to that of the examiner. The test is similar, but the examiner fixates on the patient's nose and introduces the pin midway between him and the patient, as shown here. Simple tests should be able to pick up these fairly large defects. Neurological disease typically causes hemianopias. A hemianopia may be seen in a patient with a stroke, where the nasal half of one eye and the temporal half of the other eye will be absent. A bitemporal defect is seen in some patients with pituitary disease, affecting the optic chiasm. Inferior and superior field defects may be seen in patients with optic nerve disease, glaucoma, for example, and some retinal diseases too. Testing the visual fields for large defects can thus be done simply by confrontation. Try to find a quiet, moderately illuminated room, assess the patient's visual acuity first so that you can use the most appropriate test object to use for your field assessment.